Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Clive is a 45-year-old man who was just told he has kidney cancer. Clive went to the doctor after his wife urged him after almost 6 months of having blood in his urine. Clive initially thought that this was a random occurrence, and he didn't actually tell his wife when he first noticed it. When he did notice it, she urged him to see a doctor, but he refused. He insisted that he was well. However, his wife called the doctor after several weeks of urging him to go and made an appointment herself. Clive still refused to go to the doctor, but his wife spoke with the doctor, who agreed to give Clive a call. After speaking with Clive, the doctor encouraged him to come in for some blood tests, a physical examination, and to arrange a scan. The blood test revealed that something called a PSA was elevated, but also that Clive's kidneys did not seem to be functioning the way that was expected. So, they arranged the scan as planned, and this showed that Clive had something called kidney cancer. The doctor, after explaining the diagnosis to him, told him that actually he might be able to continue to live a good life, and the risk of relapse was low in his situation because it was caught early. Clive is actually quite concerned. He wants to know if speaking to a doctor a lot earlier when he first noticed the symptoms would have made a significant amount of difference. He also wants to know, what exactly does it mean to have cancer of the kidney? Does this mean his children would have it? What is the risk of him having it, and why exactly did he have it? So, let's answer Clive's questions today about kidney cancer. Something important to note as well in Clive's story is the fact that his spouse was the one who made the doctor's appointment. This is actually rather common. Clive presented with something called blood in the urine. Blood in the urine is not normal. Blood in the urine needs to be checked. Whenever you see blood in the urine, when you're not expecting it, you need to make sure you have that checked. Sometimes people who have things like catheters put in or who have had a procedure might have blood in their urine temporarily. However, the general rule is blood in the urine is not and never normal. So, what exactly is kidney cancer? Kidney cancer happens when abnormal cells start growing in the kidneys, and they can sometimes form something called a tumor. Cancer happens when cells in the body start to change and begin to divide out of control. These cells then start to spread into different organs and can sometimes start to take control of the body's normal function. Kidney cancer often affects people above the age of 60, and it's often more likely to happen in men than in women. The rate is almost 2 times. It's also more common in Black people, similar to prostate cancer. Kidney cancer can sometimes happen in children, though, a type of cancer called a Wilms tumor that is more common in boys than girls. Like any condition, especially of the cancer type, there are different kinds of kidney cancer. There's something called a sarcoma. There's something called a transitional cell cancer, which relates to the type of cell that is affected. And then there's something called a renal cell carcinoma, which also relates to the type of cell that is affected. The renal cell carcinoma is one of the most common types of kidney cancer as well. Now, kidney cancer affects about 3% of people that are affected with cancer. However, once you've been diagnosed with one kind of cancer, the likelihood or the risk of having another one increases. And also with kidney cancer, as you get older, the risk of having cancer increases. So, like in Clive's case, he had blood in his pee, which is one of the most common red flag signs of kidney cancer. Other signs might be a swelling around the kidney area, so the loin and the lower back, just behind the ribs. Pain on that side as well, where we call the flank. Tiredness and exhaustion is actually one of the more silent symptoms. Weight loss when you're not expecting it as well. Anemia and high blood pressure can also be implicated. In Clive's situation, the doctor would have also wanted to know if he was a smoker, if he had any family history of renal cell cancer, if he had any other long-term conditions like obesity or even dialysis treatment, because that can also be implicated in kidney cancer. So a cancer on the kidney can actually be quite significant. This is because the kidney does a lot of work in the body. And so if there is a kidney that is affected or two kidneys that are affected, it's extremely important to get treatment as soon as is possible. Treatment of kidney cancer involves surgery, which could be removing part of the kidney or removing the entire kidney. It can also involve removing the blood supply that provides blood and nutrition to the cancer. Other treatments include something called radiotherapy, chemotherapy, and sometimes targeted medication. There's also something called radiofrequency ablation that uses radio waves to target exactly where the cancer cell is. This can sometimes be used, especially in cancers that are smaller, to target a specific area if you're unable to go through surgery or surgical treatment. Now, the diagnosis of kidney cancer, like in Clive's situation, includes blood tests, scans, and also taking a piece of the mass or the tumor and having a look at it under a microscope. So Clive really wants to know, is this cancer fully curable? Would he have had better outcomes if he had presented a lot earlier? The most important thing about cancer is that we detect it early. And so whenever a symptom presents, it's always worthwhile having it checked. Prevention of things like kidney cancer include avoiding smoking, managing health conditions like high blood pressure, diabetes, and obesity, and speaking to a healthcare provider whenever you notice any concerning symptoms. But also, like Clive's wife, encouraging a family member to seek medical help sooner rather than later. That's it from me from today. Kidney cancer has lots of different treatment options available. However, if you ever notice blood in your pee, it's not supposed to be there. So that's it for me from today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.